Today I'm here with Dr. Ola, who's an aesthetic practitioner and also a dentist, and we're going to be talking all things aesthetics and dental. So welcome. Thanks for joining me, Ola.
Thank you, Adrian, for inviting me.
So the first thing is, why should a dentist do or consider a career in aesthetics?
Well, I believe that is down to the individual practitioner, but in modern dentistry, I believe that you need at least to have a knowledge about aesthetic medicine if you don't practice it. Two disciplines go hand in hand together because as a dentist, we're creating a smile design. We head and neck anatomy. It's our bread and butter. We learn it inside out at university. And aging process is directly related to the changes within our mouth and teeth. And I think without facial aesthetic, you can't create 100% perfect smile because it's not only what is inside the mouth, it's also what is outside, lips, oral commissure, and general facial expressions. And vice versa, I think a beautiful face with crooked or poor looked after teeth also doesn't fit well together. So I think dentistry and facial aesthetic is a perfect match.
Brilliant, brilliant. And if you are a dentist, how do you learn and get into aesthetics? How do you see if it's for you?
If you want just to find out if that is the right thing for you, is to go on the one-day course because that is gives you an opportunity to get familiar with the aesthetic, have a hands-on to try if you actually can inject someone in the face. And also you will find if that is something that you want to learn further. And after this, there are multiple opportunities and choices how you can learn facial aesthetic as a dentist.
Okay, so what will you learn if you go on the one-day foundation course?
Realistically, Adrian, I think we all know by now that one-day course in any discipline doesn't make us a specialist.
Yeah.
It's called foundation or introduction, and that is basically where you get introduced to facial aesthetic. You get to find out how it works, what treatments are the most popular, what areas you need to concentrate on, and it just gives you an idea of what you can offer in your practice and how you can incorporate facial aesthetic into your dental practice. So it's just an introduction, but I would strongly recommend to any medical practitioner not to limit their career on the foundation course.
So the foundation's a one-day taster to see whether it's for you or not. After the foundation, what do most people you train, what's their sort of path, Ola?
What I observe now, more and more people after foundation choose to do level 7, which give you a substantial qualification. So it's a year degree, which incorporate practical and self online learning. But also other group of people, they will be doing, again, multiple courses attended different days. The most popular is one-to-one training following foundation session or intermediate training day. That is where you get further introduction into aesthetic, you learn other areas of the face, how you can treat, and also on one-to-one, you really have a good practical experience because you have between 5 to 6 models, if that is a full day course, and you have a trainer just for yourself.
Sounds brilliant. And what are the areas you might typically learn in these courses or focus on?
As you know, Adrian, our foundation course starts with upper face botulinum toxin and lower face facial fillers. And now we also introduce cheeks at some foundation training days. So on intermediate course, you learn more about cheek augmentation, perioral area treatment, and on one-to-one training, you can also get your introduction to lips.
Yeah. Okay. So that's a really good way forward for people. So tell me about how you integrate your dentistry with your aesthetic practice. I know you own clinics as well, and trainers, so you're very busy. How do you fit everything together?
I have not incorporated aesthetic into my dental practice simply because I don't have a dental practice. I, I have aesthetic practices. However, it is on my plans to incorporate dental surgery in one of my aesthetic practices, because what I see more and more patients asking me about cosmetic solution for their teeth whitening, composite bonding, straightening. And at the moment, I always refer them to the practice where I work. I still practice dentistry 1 day a week, and I quite enjoy this balance.
Okay, and tell me about some of the specific treatments dentists can do. Some of the, ones perhaps dentists may be more interested in than other practitioners.
Well, there are quite a few. One of the most very common problem in dentistry is the bruxism or grinding of the teeth. That is when patient is during their sleep, they grind their teeth, or subconsciously when they stress, they clench the teeth. And that is result in enlargement of masseter muscle. And specifically for female patient, it makes their face look more masculine,
Mm.
more square at the lower third, which is not always very aesthetically attractive. To treat this problem within dental appliances, it could be successful. However, with my experience, most patients not always compliant, not always wear those appliances, and sometimes the appliance is power of the bite could be so strong that the night guard get destroyed. A very effective treatment for bruxism is injection of the botulinum toxin into the masseter muscle and temporalis muscle. And I think many patients find this option as a better option because they don't need to do anything themselves at home. So they just come see you twice a year and they're very happy. Another problem is gingival dysplasia or gummy smile. That is when we smile and you can see the gums. So sometimes it could be related to the high frenum attachment of the upper lip. So this needs to be looked by maxillofacial surgeon, but sometimes that is just hyperactivity of the muscle, levator labii superior ala nasi. In this case, again, botulinum toxin is a very good treatment option for the patient. And often, when we talk about age-related atrophies in the patient mouth and perioral area, very often rejuvenation with hyaluronic acid-based fillers or radiofrequency treatment or even chemical rejuvenation of the skin could help patient to improve appearance of their lips and smile.
Okay, so tell me a little bit about chemical. You mentioned chemical treatment of the lips. Tell me a little bit more about that.
Sorry, chemical rejuvenation.
Yeah.
That is to do with improvement of the skin quality. And not every patient who comes to our clinic is injectable candidate. Sometimes a patient need to build a trust in you before they let you inject their face with a needle. And some patients have quite negative opinion about having fillers around their lips.
Yeah.
So chemical rejuvenation can help us to improve the quality of the skin and reduce appearance of perioral fine lines, treat condition like melasma pigmentation around perioral area. And we use, again, if we come quite close to vermilion border of the lip, we can use a specific skin peel for lips and it's 3.5% TCA. That is what I use in clinic.
Yeah.
And if we're talking about perioral area, then we can go with a stronger concentration and again use TCA peel. And in fact, we have multiple acids, mandelic, Jesna, salicylic. So it just depends what we're trying to achieve and what problem we're trying to treat.
But it's great at reducing those thin, fine lines around the mouth, isn't it?
Yes, it's quite good. And I think specific tip for the dentist, they can actually use their dental nurse for this treatment. They can train their dental nurses in chemical rejuvenation of the skin. So that is something that, for example, in our clinic can be done by therapist. Certain pills, it's only doctor or dentist application, but when it's a mild acid, it could be done by therapist. And in dental practice, it could be done by dental nurse.
Brilliant. That's great to know. Now, tell me a little bit about some of the areas. You mentioned dermal fillers around the mouth. Just talk to me about some of the areas you can treat and why we're treating the cheek more, while we're moving a little bit more to the cheek rather than the perioral area.
Well, we need to have a good understanding of the aging process, and that is why we're coming back to beginning of our conversation. We can't learn facial aesthetic in one-day course. Understanding of the aging process and changes that happening in our face is absolute key factor. We all know that we have a fat compartments, muscles, ligaments, and unfortunately those structures, they degrade with time and age. And that is with help of injectable treatments, we can restore activity of the muscles, we can restore volume loss, and we can actually improve position of our ligaments as well. So that is why we start injectable journey for many patients when we talk about anti-aging treatment with cheeks, because mid-face is where we have the most accumulation of fat compartments, and that is actually a foundation of our face that work as a support for the upper face and helps us to lift the lower face. So if we have a patient who presented to us with heavy oral commissure, if we make this topic related to dentistry, we can't just concentrate only around the mouth. We need to look at the whole face and start their journey with the cheek, and only after that treat oral commissure. You also was asking me what area we shouldn't be treated around the mouth. And what I would say, it's not necessary that we shouldn't be treated it at all as a general, but there is a right order of treatment. So we shouldn't be treating marionette lines before we had a look at the mid-face. We shouldn't be treated perioral fine lines if we haven't addressed the actual structure of the lip. So, and these rules always need to be applied by practitioner if they want to give a natural result to their patient.
That's really interesting. So do you teach that in your courses? Do you teach the regimented, the protocol, how you approach your face? Do you teach?
Oh, absolutely. And, the more you know, the more you want to share. So I always show our delegates an example of case studies. I show them treatments that I perform in clinic. So we are very open in that, and happy always to answer all their questions.
Yeah.
Absolutely. And I think treatment planning is a part that we always teach. And it has been a while since I taught foundation, actually, because I'm more concentrating on advanced courses, but I always give delegates idea that foundation is not where they can just limit their skills. And I always explain to them how the aging process work and where we need to start and why we need to learn aesthetics.
Brilliant. And do you think, there is a bit of a misconception or belief that you can always tell someone who's had treatment. Do you think you can always tell someone who's had treatment?
I don't think that you always can tell. I would disagree with that. That probably has been a misconcept from, I would say, 5, maybe 10 years ago.
Yeah,
Now aesthetic medicine moves much more towards a natural look. And we always say best injectables is undetectable. So very often you can't tell. And I do see patients in my clinics who come sometimes from other clinics, and I not always can tell what they have had. And I think that is a very good example of cosmetic work.
yeah,
You don't want the situation where you walk into the room and everyone can notice what you have done.
yeah. And I agree with you absolutely. How do you think you slow the aging process with it? What age do you think you should start? And do you think you slow the aging process with regular non-surgical treatments?
That is an excellent question, Adrian, because aging process starts very early,
Mm.
and it starts at 25. That is when our body stops producing collagen. The question is, should you start injectable at 25? And I would say that no one can give you the right answer. What is the number when you should start? For one person, it might be 25. For another person, it might be their early 30s. But I would say by the age when you're approaching your 40s, at least every person who are considering positive aging should start thinking and planning what they want to do for themselves and how to prevent things. Because preventing is much easier, much more affordable for the patient, and in the long term, you have a greater results. Because if we started a treatment with a patient who came in their late 30s and then we're maintaining them and we age, so basically we're aging together, we help them to age positively. We never come to the situation where they need probably a full facelift if they are on maintenance program. And it will be a completely different situation when we have a patient who came to us in their 60s or late 50s and have never had any treatments in the past, and in certain situation probably has been a big fan of the sunbaths and sun holidays, and it's become much more complex. I'm not saying it's impossible, but it will be completely different approach to the treatment. So I would say prevent if you can.
Okay, that's really interesting. So when you say prevent, you're trying to limit aging, Ola. Um, what would someone typically start on, and what would they progress to? So we're trying to very naturally slow the aging process and keep people looking as good as possible. What's the normal progression? Or I know everyone's different, but would be the normal?
So, yeah, Adrian, you're very right that aging process is very slow process. So that is a very good thing. We always have time to think about that. And I would say that the typical situation will be, I can give you example based on my clinic. So I think each clinic attracts certain group of patient. We have a mixture of patient of different age groups. We have males and females, but the majority of our patient will be probably women 40 plus.
Mhm.
And especially myself, I do a lot of complex and full face treatment where we restore already happened signs of aging process. So in this case, the situation will be when the patient comes, we consult and I educate them on how the aging process work, why they have these lines that they dislike, why they have sagginess, why they have wrinkles, why they have changes in the skin. And I provide them with bespoke treatment plan. And this treatment plan have stages. And the beauty about non-surgical treatments that we can work around the patient, we can work around the patient lifestyle, work schedule, and budget as well. So, and as a rule, we will perform the restorative stage where we'll bring the patient where they want to be. And after that, we're putting them on the maintenance stage where they come and have treatments with us probably 2 or 3 times a year, and that is just their maintenance program. Maintenance program combines of injectable and skin treatments, and it's also provided by doctor for injectables and therapist for skincare. It will be a completely different situation for patient who came to us at the younger age and wondering what they can prevent. So in this case, we might look to put them on a regular skincare treatment, skincare and skin treatments in clinic, and introduce them to minimal injectable procedures, probably just address their cheeks, or they might need a little bit of a Botox. But we always look at the bigger picture. We don't look just individual area of the face.
Brilliant, brilliant. And let's talk. I know you really are. You love the lips. You love the perioral area. And you're known for your treatments of it. Any tips there for anyone considering?
Oh, lips, Adrian, you're right. I love lips, but I love natural lips. And lips is one of those areas where I think specifically it should be undetectable result, because lips have such generally not very nice reputation. So the tips there, I would say, always, especially for practitioner, create appropriate lip for the patient. So it's need to be in balance with the rest of the face. And even to the patient who come to my clinic, if there is a certain patient that they're concentrating on one area, and lips could be very often this specific area that especially young girls, they concentrate and they constantly think that it's need every 6 months need to be treated. The very good tip that I would give to practitioner, probably when you have treated lips probably 2-3 times, it's not always required that often frequency of visit. It's probably the time to advise the patient to look at the rest of the face and keep these lips in balance with other facial features. And there are so many techniques to perform lips. Practitioner use needle, cannula, 4 millimeter needle, direct, indirect approach. And we cover this all at our courses. So for the delegates who want to learn, they're more than welcome. We always give them a variety of option how they can treat lip, and also can show how to perform dental block or infiltration anesthesia for patients who are more sensitive and topical anesthetic is not sufficient.
Okay, brilliant. Tell me you mentioned the difference between cannula and needle. Can you quickly tell us the pros and cons of each?
So the pros of cannula, that is minimal trauma. So we are literally able to treat the upper and lower lip with one insertion point on each side. So therefore less risk of bruising. Sometimes with cannula, you could have a little bit more swelling following the treatment because of slight trauma to the soft tissues. However, if you are bruised the patient, the swelling could be much greater following the needle treatment. The disadvantage of cannula, I would say it's probably not always 100% precise. So certain areas, if you're trying to rebuild philtrum columns, you might need a needle. If you want to be very, very specific with oral commissure, you also might need to use a needle. And also it could be slightly more uncomfortable for the patient. But generally speaking, I love cannula in the lips, and very often I would combine needle and cannula, and that is how I would do most my lip cases.
That's interesting. So tell me how you do your lips with the joint cannula and injection technique.
So usually with needle, with the cannula, I create a volume. And believe me or not, Adrian, but I always start treatment of the lips with restoring the volume rather than defining the lips.
Mm.
So, and following that, I assess if patient want a very specific, for example, a nice defined cupid's bow, or if their philtrum columns need to be defined, or sometimes patient may have asymmetry in their lips that needs a very precise injection point. Then in this case, after treating lips with the cannula, I will go and do a little bit correction and sculpting with the needle. So that is my technique. And I would say I use 50% of topical anesthetic and 50% of local anesthetic in my clinic, because I see more and more patients asking for the dental block when they come in for lip.
Okay. And any tips on dental blocks? How you give them? Any?
Again, so it's actually, so we call it, many people call this dental block, but actually what we perform is dental infiltration anesthesia. That is where we inject into the gum sulcus. And usually when we teach at the course, I give delegates as a guide the projection of your Jason or canine teeth, and that is where you see the sulcus of the gum. You inject on each side of the upper lip, and on the lower lip, that is positioning your needle between premolars. So if you count from the midline of the tooth, your injection will be between tooth number 4 and 5. And I usually use lignocaine with adrenaline, but there is strong anesthetics that is available and give quite sufficient numbness, so patient is extremely comfortable. There is a disadvantage in certain cases of giving local, because it could give a little bit of a droopy mouth and slight distortion of the lip, but you need to perform an accurate assessment before you numb the patient, and then your results will not be affected by local anesthetic.
Brilliant. And tell me a little bit. You do your dentistry and you do your aesthetics. What are the pros and cons of each?
Well, in dentistry, I'm not my own boss
Yeah.
yet, and I think it's a very good question. I think um, aesthetics. I think the main difference is in dentistry, most patients come and they have a fear very often
Mm,
first. They're a little bit tense, and they come often because they need to, because they're in
mm,
pain, because they have some problems, maybe some
mm,
facial swelling,
mm,
and they're not always happy to see you, not necessarily you as a person, but to be there to
mm,
see a dentist. However, in facial aesthetic patient, they also a little bit nervous, and
mm,
some patient a little bit anxious before the procedure, but it's 100% their own will, and they absolutely want to be there. They love the treatments. And I think dental patient, I have a very nice group of patients in dentistry. However, I just recently changed my practice. So I'm still in the process of building my dental database, but I think aesthetic patients is extremely loyal, and you basically know all their life
I
stories.
know, I know.
Well, and I think it's generally really nice helping impact of the treatment. I think is different as well. It just depends which dentistry you do. When I do cosmetic dentistry,
Yeah.
I would say it's comparable, because patient also very happy with the whitening result, composite bonding. But if we're talking about general dentistry, root canal treatment, or taking the tooth out, the amount of satisfaction that you receive from your work is, I would say, uncomparable. In aesthetic, you see results straight away, and it's rewarding for both for patient and practitioner.
Okay. And Olaf, so I know we're clinicians, we focus on the clinical side, and you're a great clinician. You're also a great businesswoman. So how did you develop your business practice?
Well, my story is very interesting. And it was my husband who started this. and he's a medical doctor. And I graduated in Ukraine. I was in the process of my exam recognitions here. I was helping him actually more on admin side and business side. So when I got my registration with General Dental Council, I came to you guys and done my foundation course.
Yeah.
But I have been in a very fortunate position because I knew a lot about these treatments prior attending the course.
Mm.
And then I have had Lawrence who just passed everything to me following the training. But saying that, I have done multiple courses and I built my clinic. I was renting a room in one of the salons and I was offering facial aesthetic in my dental practice. And within 3 years, we bought a clinic, and following another 2 years, we opened a second one. So aesthetic, it is profitable, but it also, I don't think you can expect, you need to be 100% focused on it. Like with any business, the big advantage of aesthetic business, I think you can start it very economically. So you can negotiate and rent a room in the salon, you can negotiate and rent a room at other clinic, and you don't need to have this capital expenses where you have a huge initial investment. Where I believe investment is vital is practitioner and their skills, education, technique, because aesthetics becomes much more competitive. And that is where I personally have never compromised. I always interested in learning, updating my skills. So, and I could give a good tip to practitioners: build a good friends, especially among good reputable beauty salons. I'm not talking about those that inject people where they're not supposed to, but reputable beauty salons, they would never do that, and you always will have a good referral pathway from them.
Brilliant. And it's really interesting talking to you because how many years was it ago that you actually did the first course?
My first course, Adrian, actually was skin treatments, and it was a dermaroller back in 2011.
Wow.
And again, it was with yourself. And in 2013, I did my foundation course and started to offer injectable treatments.
Right, you've come a long way in 7 years. So well done.
Yes.
Yeah. And any tips? So for any dentists out there, what would be your tips regarding getting into the aesthetics industry or learning about aesthetics?
Well, first of all, I think you just need to book on the course and find out if that is right for you or not. And if that is right for you, then you need to have a plan and plan of how you're going to introduce it into your dental practice, and plan of how you're going to improve your skill further. Because I know many dentists who have a successful aesthetic clinics within their dental practice. And on the other hand, I know many dentists who attended the course but haven't applied the skill any further. So I just think you would never know until you try. So just don't wait. It wouldn't come to your door. So you just need to try yourself and see if that is the right thing for you or not.
Brilliant. That is brilliant. It's been great talking to you. So thank you very much for joining us. And you are an absolute star. And great injector on a meteoric rise. So thank you very much for joining us today. Really appreciate your time.
Thank you very much, Adrian. Nice to speak to you.
Yeah. See you soon, Ola.
See you soon. Bye.